right, I'm going to show you guys how to put on some sterile gloves. As I mentioned in all the videos, make sure that you look at your hospital policy or your class checklist. That way you follow those protocols. This is just for demonstration purposes. So you want to make sure that, of course, your products are always unexpired. This is quantity 2. I've seen a lot of the sterile gloves that have a quantity 1, so of course you need 2 for 2 pans. All right, you're going to open your package. The outside is not sterile, the outside of this paper, so you don't have to open it that part sterilely. So I just like to open it, take out my pack of gloves. That can be trashed. So now you can see this right here says cuff end. Cuff end needs to come towards me. So I'm gonna open it up. Remember, the outside of this package is not sterile. Okay, now we're gonna open it kind of like a book. You guys can see where that little gap is in the middle between these 2 little flappies. That part is sterile, so make sure you don't reach over it. So I'm gonna go up underneath these little flaps, grab it with my thumbs, and open. You could probably see where that kind of stuck on me, and I just had to shake it a little bit. But remember, I have a 1-inch border for all of my sterile items, so you have to make sure that you only touch that 1-inch border. If you touch anywhere inside, it's no longer sterile. Now it gets a little tricky because you have to make sure that you grab the correct glove. I always like to grab with my dominant hand and put the glove onto my non-dominant hand. So I have to reach in and grab this cuff right here. You guys can see that cuff is kind of twisted. All right. So once I get my fingers in here, I want to lift it up. Make sure you lift it up, because if it's down and it starts hitting all over the table, it's no longer sterile. I'm going to take a step back. Now, you don't always see this happen in the real world. Being a nursing instructor, I want to make it obvious that I'm not reaching over my field. So then you're going to hold it and slide your fingers in. You can see how I kind of have to flip my palm over. There's going to be a little cuff here. We're going to leave it. So now you're going to take your hand. And remember, sterile can touch sterile. So I'm gonna slide my fingers, I'm gonna turn this so you guys can see, underneath this cuff. And you're going to lift straight up. Now you can see, I can put my glove there. Make sure the fingers of the glove are not hitting back on the back of my hand. I'm gonna take this hand and put it in here. Make sure as you're doing that, you see this thumb right here? It's out of the way because you don't wanna risk it touching anything. All right, so you can see I've not touched anything. Then you're gonna let it go. Now you're gonna take your finger here and push this down. Remember, you don't wanna touch anything on the outside, so I can push it down, but I have to be really cautious that I don't actually touch anything that will be touching skin. And now I have sterile gloves. I'm gonna go in, do my procedure, and then when I go to take off my sterile gloves, you're gonna have to do it a specific way, because you just imagine there's blood and all kinds of stuff on your gloves. When you do that, you want to take your hand and pinch the center, just like this. And you want to pull it straight off. Ball it up into your hand. And then you're going to take your finger from the other side and go on this inside part right here, because remember, there's growth on the outside. You're going to loop, hook, and pull. And then this is going to be thrown in the trash can.